they have a lot of power to affect the debate, but they're not really in it in the way that a lot of states in the union are, where there are large numbers of uncovered people.
Well, I mean, certainly for Massachusetts, they've had a healthcare reform that came into place a couple of years ago. They do have they had a higher level of coverage than many states to begin with, and now are at yet another level. I think there's an overreading of the Massachusetts election in terms of how healthcare played into it. But I think that the real day-to-day impact on what the Massachusetts election does to the healthcare debate is really how a bill can finish moving through Congress, and that's certainly about the Democrats being down to a majority of merely 59 to 41 senators.
Well, what do you do in that position? What are the possible, plausible playbooks that you use from this point out when you've got, as you say, only a 59-41 majority?
Well, I think a lot of the potential options are on the table and are being discussed. Certainly one is having the House pick up the Senate bill and pass that, and then because there are certainly issues with the Senate bill, the two houses had largely reached agreement about how they were going to work that out, and then really ran out of time with the Massachusetts election. So to pass another bill using the majority rules approach of budget reconciliation to make some fixes to the Senate bill and then have sort of a final product at that point. As you alluded to at the beginning, there are also thoughts of taking pieces out of those bills and passing them separately, potentially looking at a smaller scaled back approach. I think that those are less satisfying in a couple of ways. One, certainly for people who have run on a commitment to passing comprehensive health care reform and who have now voted several times on it and are still committed to getting something done. But I think also in terms of really addressing the problems in our healthcare system, both in terms of coverage and in terms of cost control. And I want to disagree with Michael on what he said about the bill and costs. Certainly there are efforts in the bill to really change how we pay for healthcare, to particularly reward providers who are providing high quality, efficient healthcare. And we have a senior fellow in my office who has done an estimate that you're looking at $550 billion, $600 billion of savings just on the federal side alone over 10 years from those kind of modernizations in the healthcare system.
What happens from here on out on the no side of the question? People who successfully have so far kept this from passing.
Yeah. Well, I think a mistake would be to think that healthcare reform in some way or shape is not going to get looked at this Congress. If you look actually after Hillary Care fell apart, Democrats actually still were able to do a lot of other stuff in terms of healthcare. They created S-chip, for example. And so I think for conservatives or for Republicans, they need to look at the fact that the left is not going to give up on this. And a lot of their ideas, frankly, are just going to bankrupt our country. We're facing one of the most serious economic crises in our country's history, and yet they're still pushing forward with some of these very ambitious and expensive ideas. So I think that would be, the fight isn't over, I think.